Hi, my name is Julie Nolan, and today I'm going to be teaching you how Indiana's Medicaid expansion program works. When the Affordable Care Act was introduced and became law in the United States, it had three main goals. It wanted to offer more preventative healthcare services, it wanted to offer affordable health insurance to a wider range of individuals, and it wanted to expand on Medicaid programs which are run by the states. Before this Medicaid expansion, only people earning 0 to 22% of the federal poverty line were eligible for Medicaid. The goal of this expansion was to extend that to 138% of the federal poverty line, considering the federal poverty line for a single individual is only $12,000 a year. Before the Affordable Care Act, Indiana had their own healthcare plan, known as the Healthy Indiana Plan, or HIP. The Affordable Care Act required that they expand Medicaid or else they lose out on billions of dollars in funding, so they decided to build onto their already established HIP program and call it HIP 2.0. The government-funded HIP 2.0 program is comprised of three plans: HIP Employer Link, HIP Basic, and HIP Plus. The Employer Link offers people health insurance through their employer, so we will focus on HIP Basic and HIP Plus. HIP Basic is only available to those within 22 and 100% of the federal poverty line. There are no monthly payments, but there are co-pays for every single medical service received. And in the long run, it tends to be more costly than HIP Plus. HIP Plus is available to anyone between 0 and 138% of the federal poverty line. It requires monthly premiums, but they're based on income, so they're capped at 2% of your income. Originally, it included lockouts, but they were deemed unlawful. Overall, it offers more benefits than HIP Basic and tends to be less expensive. Some drawbacks from HIP 2.0 have mostly stemmed from affordability and from lack of education. Many people don't understand what they need to pay, and many people also don't understand how to enroll and how to stay enrolled. Overall, HIP 2.0 has expanded coverage and it has offered more options to people who are in need of health insurance. But like many things, it still needs some work. It's not perfect right now, but hopefully we can get to that point someday. Thanks for watching, and I hope that you have a better understanding of Indiana's Medicaid expansion program, Healthy Indiana Plan 2.0.
Created using Powtoon.